In Lab E, the collimator is slightly different than the others. However, we still have the same buttons. We have longitudinal, which is the length of the table movement, transverse, which will be side to side movement. We have the vertical, which will not stay in. You must hold it in to move the tube from up or down. We have the angle and the angle measurement at the top. We can rotate the tube easily to 15 degrees or more. It will lock in at 0 or vertical. And our detent button, which are the electronic alignments for source to image receptor distance, SID, and the transverse lock to assure that you're aligned with the middle of your image receptor when it's in the bucky. Collimation is at the top, and you have a readout at the 40 inches, and you may change it to different distances depending on what your source to image receptor distance is, or SID is. We generally work at 40 inches, and in this case, because we have a panel which is 17 by 17, you must select the size of the collimated field that you choose to radiograph. Currently, we are not aligned. We are going to take the detent button and select it, the transverse, and get locked in from side to side. You'll hear the lock in. Then you can release the transverse. You are now aligned. You may check this by looking at the ceiling, and you will see the label table to indicate that you're aligned to the table. Vertically, we need to select 40 inches, and you will move the tube up or down until it locks into place. Now, if we want to check longitudinally, we have to look at the image receptor. The image receptor is in the table, and the little bar that sticks out is what you'll be centering to longitudinally. To move the bucky, you will grasp the handle, press the button, and the image receptor may be moved to the top of the table, to the foot of the table. If we activate the light, you will see the centering point and can center the image receptor accordingly. Let go of the lock and it will lock into place. Now, if we want to move the patient to the center, you press the foot pedal and you can move the table from side to side or from top to bottom. To allow patients to get on and off the table easily, we have a motorized table. We can lower the table for the patient to get on. When you do that, make sure that your tube is not over the table so they do not hit their head. Once they get on, you will bring the table up so that you may use the table at the proper height. Make sure once you've done that, you check your vertical and that you have the proper detent, or at 40 inches. The flat panel detector is currently in the table. We are going to release it and pull it out. And at this point, you must get your faculty instructor to move the panel to the upright bucky. to the upright bucky, we are going to select vertical, transverse, and longitudinal. Bring the tube down and bring it over. We're going to select a tent because we want to do alignment. But first we must angle the tube so that it will recognize. So there we are. Bring the tube down and over until, or away from you, until it locks in place. Now it is aligned for SID at 72 inches and transversely for the upright bucky. Deactivate longitudinal and transverse so it stays in place. Now, we activate the light field. We are at 72 inches now, so in the collimation we must change to the 72-inch increments and open the collimators to the size of the image receptor that you would like to use. Remember, the image receptor is 17 by 17. The only control of the image field is your collimation. Using the vertical, we can align to the center of the image receptor. However, if your patient is taller and your light field is here, you will use the handle and lock for alignment purposes. Now we have transverse alignment, vertical alignment, and we're at 72 inches for an upright chest image.